Welcome to The Topic, where we highlight Houston Community College, our students, our programs, and our reach into the community. I'm Todd Duplantis. Healthcare is a rapidly growing sector of the economy, and HCC provides students a pathway to enter the field through its medical assisting program. Director Cynthia Lundgren joins us today. Thanks for being here on The Topic.
Thanks for having me.
Now, tell me about the medical assisting program. The name seems obvious, but what type of roles would a medical assistant do?
Well, the medical assistant is like the liaison between the patient and the doctor.
Okay.
And they're the ones that are going to greet you when you go to the doctor's office. They're the ones that will answer the phones. They're the ones that are going to put the patient into the treatment room, take the vital signs, room the patient.
Okay.
They may even draw blood, give injections, run EKGs on patients. So they do a lot of clinical work and also administrative work. And the administrative would be the processing of the insurance, verifying the insurance, entering that information into the data, and being able to send information to insurance companies and having that revenue come back to the doctor.
So it sounds like in a private practice, they're the most important part of the medical practice there in a lot of ways, for the doctor at least.
Yes, for sure.
Now tell me, what type of levels of certifications do you have?
Well, in the medical assistant program, we offer a level 1 certificate, which is the medical scribe.
Okay.
And actually that's part of the medical assistant program. But with that level 1 certificate, the students can actually get into the health field. Scribes are very essential right now because they are the clinical information managers.
Okay.
So they're gathering all the doctor's information as far as the lab work and EKGs and operative reports, all that information into the electronic record for the doctor to view. And then once the patient goes into the treatment room, the scribe follows the doctor, and the scribe is putting that information into the electronic record, the actual patient and doctor conversation, the actual charting of the information goes into the electronic medical record.
So they're taking notes more or less right then and there, actual time notes to make sure the doctor has everything they need.
Live time charting, yes.
Right, so the doctor doesn't have to rely on going outside and compiling notes after they meet with the patient.
No, and so that's why it's very important that the medical scribe have good listening skills and good typing skills and knowledge of computers.
So you have different levels of certifications, and I imagine this goes on until 2 years. Is there opportunity to move on to a 4-year program?
Well, medical assistants, once they come in, they do the level 1, they go to the level 2, which is the medical assistant certificate, and then they can also get an associate of applied science and allied health.
Right.
Now, with that, that's a stepping stone that leads into 4-year university, maybe to do healthcare administration. We do have some of our students that come back and do their nursing because they already have the background as far as patient care is concerned.
Right.
And then they can go on and get their bachelor's degree either in nursing and whatever other field that they may like to.
It sounds like a jack of all trades, to use an old term. I mean, you're doing a lot for the doctor's office. I imagine everything from billing, or helping out with the billing, all the way to drawing blood, from what you're saying.
Right, and the thing is, you need to find out whether or not health field is for you.
Yeah.
And since medical assisting has so many different areas, they can go ahead and decide, well, maybe I like that field and I want to concentrate in that.
As the population is aging and getting older, a lot more need out there for medical care. Are these jobs in the sector that's growing themselves?
Oh, the medical assistant is growing exponentially simply because there are, hospitals and there's professional buildings. So, there's a lot of clinical ambulatory care centers, urgent care centers. So medical assistants are finding their niche there. And we have so many different clinics that are looking for medical assistants because they can do all those different aspects in the office.
And being that you are in the medical center, when Coleman, they're going to get a chance to, I guess, get a taste of a job before they move on to it.
Well, we do a practicum, so the students are there at the clinical site for about 240 hours, which could be anywhere between 8 to 10 weeks.
Right.
So the clinical sites get to try before they buy, so they get to know whether or not this is a good fit for their clinic, and so they may receive job offers as soon as they've completed their practicum. They're eligible to be hired. So the students are finding their employment at the practicum sites.
Absolutely. Thanks for joining us, Cynthia Lundgren, and we appreciate you being here on The Topic. If you'd like to learn more about this growing field, you can check out hccs.edu/medical assistant. For The Topic on HCC TV, I'm Todd Duplantis. I'll see you next time.